How do you prevent or get rid of a dog ear? We're going to discuss that today. So first of all, what is a dog ear? A dog ear is an incision that's been closed, and then once it's closed on each corner or one corner, you find a lump of pucker of tissue, a lump sticking up, and I guess that's why it came up with a dog's ear, because it's the head here and then an ear on either side, which looks great on a dog but not so good on a human incision. So you don't want that to happen. So how do you get a dog ear? Here would be an incision you might get for like a mastectomy, or if you're taking a graft. You're always going to be making an elliptical incision. Circular incisions do not close well because there's no corners. It won't come together. You'll end up really lumpy and puckered. It'd be purse stringing it. So all the incisions are going to be elliptical, shaped like an eye. This one here would probably create a dog ear, because the problem is that you have too steep a gradient from the corners to here for it to be able, the skin to be able to adjust, because once you pull this together with this and keep working it down, by the time you get to the corners, the skin just can't adjust for all of that, and it ends up with a pucker in the corners to accommodate you having closed this part of it. So this is a better shape. This is the elliptical. This one's gentle enough that this will probably come together really well when you close it without having a dog ear. And if you did end up with a dog ear in this one, it would only be a little tiny one in the corner that would be easy to take care of. So this is more what you're going to be looking for. So the final demonstration, which I can attest to because I had a small squamous cell, and it was about the size of this dot that you can see. And by the time the doctor makes his elliptical incision, which is black here, makes the elliptical incision and then closes that, it actually ends up lengthening more. Even any of these incisions, once you close them and pull that together, you're pulling this in, and this ends up migrating lateral on either side a little bit. So this incision, once they close that, would probably be the same length as this red line. And this is a pretty impressive dog ear. We're going to work with this one because I've already shot this once and wanted to reshoot it because I wanted to be a little clearer with some things. So that's what a dog ear looks like. So originally, well, first I'll tell you, there's two ways to cut it. You can either cut it with a knife, which some surgeons choose, but I prefer to use the suture scissors because they're straight and they'll cut straight, and you see all the laxity that you have here in the tissue. It's going to be hard to get a knife to cut straight on that. You'd have to try and pull it tight. So originally, and I've tried different ways, this is the one that I find is the most consistent and that works the best for me, so this is what I use. So you're going to, originally, sometimes I would just pull it up in the corner. First of all, you're going to suture your deep dermals, not your surrounding subcuticular, but you're going to suture your deep dermals to about this far from the edge. About 1 centimeter. 1 to 1.5 centimeters from the edge, so that it can come together and you see exactly where the dog ear is. At one point, I was freehanding it. I would lift it up and I'd cut like this. The problem that I found with that is sometimes it didn't line up with this incision. It would veer off north or south. So a better way to try to avoid that and make it as straight as you can is to get a marking pen, take your incision, lift it up, find the corner, lift it up on the corner, and then use a marking pen to mark it, and you want to try and ease into the incision that's there. So you'd go on either side, mark it, bring it in, and see it's going to come back a little bit, which is why you don't want to take your deep dermals all the way to the edge. Now I have it marked. I know where it goes. I know where it's going to end. I know that it's going to be straight. And I find the best thing is to just cut it right down the middle to the corner. And then you see what that does is you can see how it's going to lay. The skin edges lay flat, and then you can pick up one triangle at a time and cut it. Move in whatever direction you need to move to get your scissors to cut properly. And then same thing on this side. Cut to the corner. Now what you need to do is you'll need to stop the bleeding in here. And I don't know if you can see it there, but usually you have these little tiny corners here at the end of it. As I start suturing this together, so you can see the dog ear is gone, it's going to come together. And when I get to this area that was the end of my cut with the suture scissors, I just cut those little tiny triangles off as I go, and then you can fit it in really nicely. A little triangle on this side. You just cut off that little tiny bit, and by the time you're done, you have a nice straight incision, and the dog ear is gone. So the way I feel is the patient would much rather have a slightly longer scar, which is probably going to fade and be hard to detect anyway, than to have an ugly lump on the end of each side of the incision, or even just one side of the incision. So that's how you take care of a dog ear.